Hey, Becca Janae, good to see you. Welcome, everybody, and excited to get this video going here. Come on. We're going to be talking a lot about blood work today and what you guys need to be doing to know exactly what's going on inside your body. So here's the deal. When you are getting blood work done, most of the time, doctor comes in and says, oh, you know what, everything's good. You know, it's in the okay range. Not sure why you're tired. Not sure why you're overweight. Not sure what's going on with your thyroid. But here's the deal. There are reasons why your body is not right, and we can find those in the blood work, and I'm going to show you today. So get out your pen and paper, and next time you get your blood work done, you've got to get these tests done. These are crucial to truly know. If you do not have optimal health, you need to be checking those. So welcome. Pop down below where you guys are watching from. Love to see you guys all over the world, and let me know when your last blood test was. Let me know if you had any of these markers run, and if you did, put them down below and I'll let you know. Do I think that's high or low? And give you some ideas on what could help that as well. So here we go. Let's get into it. So blood work is a crucial part of any diagnostic for getting people their health back. And you've got to run blood work. But so many times people are like, well, you know, blood work, hey, Karen, there in Ohio, blood work doesn't really show a whole lot. My doctor, every time I go, they say it's fine. It's really not gonna be worth it to go because he says, everything's in the good range. Eat better, lose weight, whatever it is. But here's the deal: you're probably not getting the right things tested. I'm about 99% sure because we run this with patients all the time. We run into this where patients get blood work done and they're not getting the full panels done outside of what we're doing. Hey, Karina in California, good to see you there. So you're probably not getting it done. But then the other part is you're not looking at it in the right range. So if you remember that there was a class called statistics, some of you may have blanked that out. Give me a thumbs up if anybody actually liked statistics. We probably won't see a lot of thumbs there. Hey, Blue Jean Baby 78 in Louisiana there. Good to see you. And then we've got some inflamed liver and spleen as well. We'll get to that also. So in statistics, they talk about the bell curve, and you've got, if they're inside that bell curve, everything is okay. It's going to be average, it's going to be okay. But really, we need to be even narrow that down to what optimally healthy people should be. And so that's what I'm going to show you guys today is not only that you're not testing everything, but you're not looking at it in the right range as well. And 18 and Beans, good to see you there. Paula in Colorado, good to see you. So again, pop down below where you guys are watching from. Love to see it. Let's talk about this. Let's write down what tests that we're looking at and get those done next time you get blood work done. If your doctor won't run those, we can drop ship those kits to you anywhere in this country. So what are we talking about? We are talking about which blood tests you need to be running and which ones that you're probably not doing, and then the range as well that's important. Hope Clark Henry, good to see you there in Georgia. All right, got an appointment. Awesome. So let's get into this. Here's some markers that you need to be testing every single time. If you've seen my videos before, you know this is my number one favorite marker, and it's called ferritin. And ferritin, most people, they'll get iron tested, and it's serum iron. Hey, Lucy in South Africa there, they'll get iron tested, but they're not getting ferritin tested. And let me know if you did get your ferritin tested. Put that number down below, and I'll let you know if it's good, high, low, what's going on there. But ferritin is the number one best marker. If I could only test one marker on everybody, it would be ferritin. If ferritin is low, that's usually an anemia issue. And so that's the big concern for people. They're anemic. If you get pregnant, you don't have enough iron, your hemoglobin goes down. mic is off. There we go. And so Tisha, let me know if that says it's in the okay range, because this is a perfect example. So Tisha's ferritin is at 16, and the cutoff is probably like 14, 15, something like that. And so she's okay. But yeah, range starts at 16. So she's okay. 16 is still okay. And yet I like ferritin at least 40. So Tisha, your ferritin is really, really low. So Jacqueline, your iron is low, but your hemoglobin is okay. You need to look at your ferritin, and that's how you're really going to tell what's going on. And the hemoglobin, here's the deal with hemoglobin, you have to come into consideration for what elevation you're at. So in Colorado here, ours is going to be definitely definitely higher than it's supposed to be. So Jacqueline, iron is 32, but ferritin is 18. Both of those are very low. You are not storing iron. So I don't really care what your hemoglobin says. You are low iron. There is some type of anemia going on. We've got to figure out why, because ferritin is the symptom. Ferritin is not the cause. Ferritin being low, ferritin, Tiffany, is stored iron. So we've got serum iron, and then ferritin is stored iron. So we've got to get that figured out, why it's going on. Usually it's a malabsorption, it's some type of leaky gut, some type of a gut issue there is usually why we're seeing that. So ferritin low, gut, sometimes you're bleeding, you're having your menstrual cycle for 2 weeks straight and it's really heavy. But most of the time it's a gut issue in there. The second side of that, high ferritin, again, ferritin is stored iron. Ferritin high is going to be more about inflammation. It's going to be an indication that somebody's triglycerides are high, that their C-reactive protein, their inflammatory markers high, they probably have some blood sugar issues. And are going to be problematic that way. So absolutely, we've got to look at that ferritin. So if your ferritin's under 40, look at your gut lining, look at leaky gut, some of those things. If it's too high, look at insulin resistance. You're gonna have to do a liver cleanse, do a bunch of things to get that better. And so it's low again. So beautiful, weird Oz. So here's the deal. You did not fix why your iron is low. So just by taking some iron medication, just by taking some iron supplementation, it's not going to fix the problem. And so you've got to dig deep. And if you stop taking iron, but you didn't fix the why, you're back to square one. So that's what's going on there. Okay, so ferritin, get that tested absolutely 100% every time you get blood work tested. Number two thing that you need to test is what's called GGT. And GGT is going to be a liver marker. And if any of you have that out there, let me know. But if your GGT is over 20, very good indication that your body is creeping in towards fatty liver, that you are having blood sugar issues, insulin resistance, that you're having some problems with those blood sugar swings, too high and too low. And every time that blood sugar goes up too high, we store it in the liver. Every time it crashes down too low, it's going to kick out of the liver. So we go liver, 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 over and over and over. Hey, Brittany, Jacqueline's asking about healing leaky gut. Pop some video links on there about leaky gut, and we'll go through that. So here's the deal with leaky gut is we've got to get deep into the why, into why somebody's gut lining is problematic, and that's usually some type of food allergen, microbiome imbalance. We've got inflammation in the gut, a lot of different things in there, but we'll get you some links to that. I've done a lot of videos on there as well. So GGT, if your GGT is over 20, you're creeping towards fatty liver. Without doing an ultrasound, we can't tell for sure, but ultimately you've got to learn and figure out why that's out of balance and what you need to do. Usually that's a stabilizing of the blood sugar, get it as consistent, 85 to 110 as possible, do some liver cleanse, and that's going to make a huge difference on there. So ferritin, GGT, you need to be checking your vitamin D every time. Your vitamin D should be between 60 and 80. If you have autoimmune disease, it needs to be upwards of 80. So if you're not testing your vitamin D, so my vitamin D was at 3, now it's at 17 for almost 4 months. So a lot of people with vitamin D, if you can't get your vitamin D up, Florida Gal 80 is best, especially if you have autoimmune. If you can't get your vitamin D up, then you may need to get outside more, like Florida Gal, probably pretty easy down there, but it's going to also be a potential of going to the sunbathing, get the sun tanning in one of the tanning beds, and actually get that vitamin D from a tanning bed, and not to where you're like leather skin, but, and this goes against a lot of people's thoughts, and that's a big probably saying I'm crazy, but you've got to get that vitamin D up, and sometimes the sun tanning beds are going to be one of the best ways to do it, especially if you live in Minnesota. Isn't tanning beds bad for you though? So Tiffany, that's what a lot of people say. Again, if you, but here's the deal, Florida Gal. A lot of people, what do you do in Minnesota in the winter? You can't, you're not going to get out in the sun. So you've got to go and do some exposure like that. Even 10 or 15 minutes a week in a tanning bed can get vitamin D up a whole lot. So it can make a big difference there. Here's what we're looking at then. Ferritin, stored iron, GGT tells us about fatty liver, vitamin D, crucial. You need to check for autoimmune markers. So if you have not yet, you need to look at ANA and RF, rheumatoid factor. We see about 25% of our patients come in with at least one of those positive, and a lot of times they don't even know that they have an autoimmune condition. Along those same lines, you can also check for Hashimoto's antibodies, the TPO and the thyroglobulin, and you'll have a really good idea of what your autoimmune activity in your body is doing. Are there injections for vitamin D? Nothing great. I have not seen that. Florida Gal positive ANA. Check out our video. Brittany, is that next Tuesday? We're going to be doing the autoimmune workshop webinar. We'll be doing that live on TikTok next Tuesday at 6 Mountain Standard Time. Where seasonal depression comes from. What about something like red light therapy? I have not seen the red light therapy build up the vitamin D. You could try it, but I have not seen it. You would just have to do it and then retest your vitamin D, and if it goes better, great. But here's the deal: if you live north of basically the Missouri, Arkansas, Kentucky, that whole border through there, you're probably not going to be getting enough vitamin D, especially for 6 months of the winter. You're just not going to have the exposure that you need to. So you got to either take it, but if taking it doesn't get you up enough, then do some sun tanning beds, and even a small amount of that can be very helpful in there. So that's going to be great. You want to check those antibodies, ANA, rheumatoid factor, and the 2 Hashimoto's markers, so you can tell which type of Hashimoto's you have. And then another one that you need to test is what's called insulin. Insulin is what grabs glucose and pulls it out of the bloodstream. But here's the deal: I like it non-fasting, and I like that insulin to be done just throughout the day, randomly, 10, 11, 12 in the morning. Kristen, B12, we'll talk about that in a second. So I really like that random, and that's going to make a big difference in there, because a lot of times your body, if you've gone 10, 12 hours, it can stabilize the insulin. But if you're eating and your body is all over the place, if you have insulin resistance, that's going to spike up really, really high and cause some major issues in there. We'll see insulin, I don't like it over 10, maybe 12 non-fasting. We'll see it 30, 50, 100, 150 on people, and like extreme insulin resistance. So you've got to check that one, but check it non-fasting versus everybody out there is like, oh, you got to do fasting blood work. But here's the deal: we get so much more information non-fasting. Kristen, B12, it really is going to depend on how much B12 you're taking into your body. Maybe if you're not taking B12 and you see that it's really, really low, you should take some B12. But I do not see that as a huge issue there. So what about, how about thyroid? So Tiffany, here's what you need to test for your thyroid. You need those thyroid antibodies, TPO and thyroglobulin, and then you need your T3 and T4, both free and total. So there's 4 times that you test that T3 and T4 and your TSH and your TPO and thyroglobulin. So those are the thyroid numbers you need to look at. So again, if you guys are out there and you're like, well, this is all great, but I can't get it tested, my doctor won't test that, click the link in the bio if you're on TikTok, or send us a DM on YouTube or Facebook, and we can get you guys a blood kit drop ship no matter where you are. So if you can get into the Colorado or Tennessee offices, great, come in and we'll bring that blood work, all those things. But if you can't, we can drop ship that blood kit to you all over the country, and we do all of these tests on every single person. And most diagnosis is lupus. They can't figure it out. Yeah, so lupus, if somebody has an ANA high, it's most commonly lupus, but it can also be Sjogren's, mixed connective tissue, things like that. Just low kiss. We've got any advice for thyroid? Absolutely. Again, you've got to figure out whether it's a thyroid issue, or it's autoimmune, or it's under conversion, in which case it's liver and gut and all these other things. So you've really got to figure out what that underlying why is. And if it is autoimmune, then you've got to calm down that autoimmune and not just go, oh, here, I'm going to take some thyroid supplement or some support. And I like most docs. My thyroid is 0.89. Isn't that really low? So it's not your thyroid. I need to see. So my thyroid is 8.9. That's actually your TSH, is my assumption, is that your TSH is 0.89. And TSH is thyroid stimulating hormone. Sweet, Michelle, I did my blood work for you guys yesterday. Results next week. Awesome. So excited to see what it shows up. I guarantee you there's going to be some stuff that we see. So my thyroid is 8.89. That's TSH. Thyroid stimulating hormone is actually a pituitary hormone. So it's actually going to be that pituitary that's telling the thyroid what to do, and that's the 0.89. So if it's low, in theory, that's because we have too much thyroid hormone, but it can also be a hypopituitary. So if your T3 and T4 are low, your TSH is low, that's usually because the pituitary is worn out from adrenal issues. Thoughts on long COVID symptoms, cleanses? I thought you mentioned it briefly before. Yeah, so long COVID, a couple things. Can be chronic Epstein-Barr virus, where you got this reactivated Epstein-Barr. So we've got to deal on the immune system and calm it down and all types of those things. And then from there, you also have to look at this immune inflammatory cascade. So a lot of people, their autoimmune has gotten triggered, they're getting all this inflammation, all these things. So you just got to work on all your systems that are inflamed and revved up and get that down. If you need help, give us a call. I'm in Canada. What about those lamps that that people use? Yeah, try it. So do it and try it. Not sure. Can Epstein-Barr virus reactivation affect thyroid? Kim, absolutely. And this is one of the common reasons that we see autoimmune. And so there you go. 80% of low thyroid is actually Hashimoto's, which is autoimmune. So we know that Epstein-Barr virus can be reactivated, and then it can stimulate autoimmune, and that can drive that Hashimoto. So it absolutely can affect that. Florida gal has to be tested randomly. Absolutely. My 8-year-old daughter has an enlarged thyroid, and her TSH is elevated, or T3 was normal. Any advice? Yeah, so it sounds like it's going into this autoimmune hyper state, probably gonna get revved up, and they're gonna want to irradiate it, take it out, something like that. So you better do everything you possibly can to calm down her immune inflammatory system right now. Look at the leaky gut, look at the blood sugar, look at the liver, look at the adrenals, look at hormones, all these different things. But if you need help on that, because you got to take massive action very, very quickly, let us know, and we can help you through that. And Flaxseed oil. Does bone broth help with leaky gut? It can, but if that's all somebody does is just add in bone broth, that's not going to fix it. We use bone broth all the time with patients, but we're doing 20 other things to fix that. Do you do any holistic care, not just recommend medication? Just little kids, absolutely. So here's the deal. I do not prescribe medications. That's not in my wheelhouse. That's not what I want to do. I want to get people actually off their medications and to take as little of anything, whether it's a supplement, medication, prescription, anything at all, take as little as needed to get the desired result. So that's my goal with people. And so we give nutritional support, so that could be supplementation, cleanses, support for the gut lining, all these things. We do dietary changes. One of the biggest things we start with is blood sugar monitoring, where we'll put a continuous glucose monitor on every single patient and get them to stabilize their blood sugar and work them through a lot of ways on how to sleep better, digest better. If somebody gets a brain map done and they've got a lot of brain issues, we can do neurofeedback, all types of different things. So medication is not what we're looking at doing with people. Get on an anti-inflammatory diet. But here's the deal. It all depends on the person, and it's all going to be unique for them. High blood pressure medication. Yes, there is some heredity to it, but here's the deal. 99% of patients, if they have high blood pressure, we fix their blood sugar, their blood pressure goes down. For that small percent that doesn't help, then we go and we start working on their brain and get them out of that fight or flight. So it's a major part of the process is getting that blood sugar stabilized, and then going through helping that brain as well. What vitamin D for diabetes? So doesn't matter. Betsy makes his money on supplements. Actually, we don't sell that many supplements. That's not our shtick. I haven't sold a blood sugar supplement in months, if not years. And again, it's not that I'm not allowed. I have a nurse practitioner on staff. We could prescribe medications, all those things, and yet I choose not to. If somebody does need to continue on their thyroid medication, or somebody does need some type of another medication, we'll refer out and we'll do those things. But here's the deal. Every one of our F8 doctors, their main goal is to get somebody to take as little supplements, medication, whatever it is, as needed. So thanks for the comment there. Let's see. High set rate on hydroxy, doing physical therapy. My joints hurt so bad. What can benefit me? So this is Jessalyn. So here's the deal. It's some type of autoimmune going on in the body. You're creating some major type of immune inflammatory cascade, and you're going to need to calm that down. You're going to need to get it to a place where your body isn't attacking itself anymore. So again, check out our autoimmune workshop next Tuesday, but we've also got some videos on YouTube that you can look at. Just search autoimmune. But again, you've got to look at adrenals, blood sugar, leaky gut, vitamin D, infection, all of these different things. And that's going to be a huge part of this process. So you've got to fix the why. So, all right, guys, I got to jump, got patients to see, but love having you on. If you've got questions at all, pop those down below, and I'll love answering those. We keep an eye on this all day long. Follow us on YouTube. We've got over 700 videos on there. You can search way easier on there. If you need help, if you're not getting the success you need, if you're not getting the doctor to run this blood work, any of these things, click the link in the bio or DM us, and we will schedule a discovery call, and you can sit down and go, okay, hey, what is running that blood work? Is this going to be best for me? We can figure out which path to go, and we will help you get your life back. So love seeing you guys. Take care. Make it a great day.